Anxiety and fear in adolescence. Dear parents, adolescence, also known as the teenage years, is a time of great change and challenge, not only for our children but also for us as parents. Teens grow and change every day, and along with those changes come inner worries and anxieties that they may not always express. Sometimes, their anxiety is greater than we realize, even affecting their academic performance and daily lives. In today's discussion, we will explore common worries that teens experience. We'll look at the difference between normal anxiety and when it becomes a more serious concern, known as an anxiety disorder. We'll also review common types of anxiety disorders, the contributing factors, and most importantly, practical ways parents can support and walk alongside their children through this sensitive stage. Let's dive in. Understanding natural anxiety and fear. First, let's explore what anxiety and fear really are. Much like how we feel pressure during stressful times, anxiety and fear are natural human psychological responses. From birth, we have these built-in mechanisms to alert and protect us from potential dangers. Thanks to these feelings, we learn to be cautious and stay safe in the world. Although both anxiety and fear help protect us and can trigger similar physical reactions, like trouble sleeping, sweating, muscle tension, or fatigue, they are not the same. Anxiety tends to be persistent and revolves around something that might happen in the future, often vague and internal. Fear, on the other hand, is an intense, short-term response to a specific, external threat. Stress is another related concept, a response to a challenge that urges us to take action or adapt. Interestingly, what causes anxiety or fear changes as children grow. Young children often fear external things like animals, darkness, or something bad happening to their parents. But as they enter adolescence, their worries often turn inward. For example, many teens worry about academic performance. They may feel immense pressure to be smart, capable, or perfect. Even if parents say, "Don't stress too much," the pressure still lingers. Then there's worry about how others perceive them. At this age, peer and adult opinions matter greatly. Sensitive teens may overly fear being judged, criticized, or embarrassed. And of course, worries about physical changes during puberty are very common. Developing earlier or later than peers can make teens feel different or isolated. Imagine a 14-year-old boy who hasn't yet hit puberty, still looking like a child while his friends have grown significantly. That can deeply affect his confidence. Some teens even become overly self-conscious about small imperfections in their appearance. When does anxiety become a concern? We all agree that anxiety and fear are normal, even necessary, emotions. But they become problematic when they're excessive, persistent, hard to control, and significantly interfere with daily life, from academics and routines to relationships. At that point, a teen may be experiencing an anxiety disorder. Recognizing anxiety disorders in teens isn't always easy because symptoms vary. Some teens withdraw and avoid others, while some become irritable or quick to anger. Plus, teens often try to hide their feelings or hesitate to share what they're truly thinking. So how can parents tell? Watch for these signs: frequent complaints of stomach aches, headaches, or fatigue without a clear cause, difficulty sleeping or constant tiredness, avoidance of school or reluctance to join peer or social activities, extreme nervousness during social interactions, perfectionistic behaviors, such as redoing homework repeatedly for fear it's not perfect, spending an unusually long time on schoolwork, low self-esteem or self-criticism, constant need for reassurance from parents or others, mentioning an interest in trying alcohol or stimulants. If you observe several of these signs in your child for an extended period, it's time to pay special attention. Common types of anxiety disorders in teens. Anxiety disorders come in many forms. Let's take a look at some that are most common among adolescents. 1. Generalized anxiety disorder. GAD. Teens worry excessively about many things: school, friendships, health, the future, and feel like they can't control the anxiety. 2. Social anxiety disorder. An intense fear of being judged or criticized. Teens avoid social situations, fear going to school, or shy away from talking to peers or adults. 3. Separation anxiety disorder. An overwhelming fear of being away from close caregivers, often parents. Teens may refuse to sleep alone, go anywhere without a parent, or have nightmares about being harmed or losing a loved one. 4. Specific phobias. Intense, persistent, and irrational fear of a particular object or situation, like heights, confined spaces, insects, blood, or flying. 5. Panic disorder. Sudden, severe panic attacks without clear triggers. Symptoms include racing heart, shortness of breath, sweating, chest pain, fear of losing control or dying. Attacks are brief but terrifying. In the US, around 8% of teenagers experience anxiety disorders. These issues can severely impact a teen's life, hindering learning and social development. If symptoms last longer than 6 months, parents should seek help from a doctor or mental health professional for early diagnosis and support. What contributes to anxiety disorders? Why are some teens more prone to anxiety than others? While everyone experiences anxiety at times, several factors may increase the risk. 1. Biological factors. Genetics and certain brain structures or activity patterns may contribute to anxiety. Overactive areas in the brain, for example, may heighten anxious responses. 2. Temperament. Introverted teens who are inward-focused or those with perfectionist tendencies are more at risk. 3. Past experiences. Trauma, major life changes, or poor physical health can increase vulnerability during adolescence. How can parents support anxious teens? Now that we understand more, what can parents do to support and accompany an anxious or shy teen? Unlike sadness, which can fade over time, anxiety often lingers if not addressed at its roots or if teens don't learn coping skills. If their fear relates to harmless things like bugs or mice, it might be manageable. But if their worry leads to distress or disrupts life, we need to help. Here are some suggestions. Create a worry jar together. Encourage your teen to decorate a small jar. Each day at a set time, they can write or draw their worries and place them in the jar. If a worry pops up suddenly, they can do the same. Later, they can revisit past worries to reflect on whether they actually came true or faded over time. Encourage gradual exposure to fears. The natural instinct is to avoid what we fear. But avoidance feeds the fear. Facing fears step by step is the best way to overcome them. Therapists use this approach professionally, but parents can apply it in simple situations too. For example, if your child is afraid to make friends at school, start with having them say one sentence to a nearby classmate. Then gradually expand social interactions. Practice relaxation techniques. Mindfulness and breathing exercises can help calm anxiety quickly. Guide your teen to take slow, deep breaths and focus on their breath while relaxing their body. Just a few minutes several times a day can help. However, remember that these techniques relieve symptoms, not causes, so adult support in solving real-life challenges is still needed. Seek professional help if needed. If anxiety symptoms persist for more than 6 months and affect your teen's life, don't hesitate to consult a mental health professional. Therapy, and sometimes medication, can make a huge difference. Finding a reputable hospital or counseling center can save time and improve outcomes significantly. Closing thoughts. The parenting journey during your child's teenage years is never easy. Understanding and walking with them through their anxieties is a key part of that journey. We hope today's insights give you the knowledge and confidence to support your child in the best possible way. Always be their safe place and greatest source of encouragement.